Okay, good morning and thank you for joining us on this Friday, February the 7th. I'm Kristen Shanahan, the Public Information Officer at the Louisville Metro Department of Public Health and Wellness. As you know, there has been a spike in flu cases and outbreaks here in Louisville Metro. Here to share an update about the situation is Dr. Chris Bryant, our Associate Medical Director at Public Health and Wellness and Pediatric Infectious Disease Specialist at Norton Children's. Also joining us is Dr. Patricia Bautista Severa, the current chair of the Louisville Metro Board of Health and the Health Empowerment Coordinator for La Casita Center here in Louisville. I'd like to ask everyone to mute your devices. When we turn to questions, please raise your hand so I can call on you, or you can put your question in the chat. For members of our Spanish media, feel free to ask your questions in Spanish. Let's start off with Dr. Bryant. Dr. Bryant, can you give us a situation update?
Thanks so much, Kristen, and welcome. So flu season is in full swing and children are being hit especially hard this year. We have had multiple outbreaks across the metro area, affecting schools and early child care centers. Last week at Norton Healthcare, more than 3,000 children tested positive for the flu. So far this week, more than 2,900 kids have tested positive. The week's not over. That number's still going up. I'd like to remind everybody that Louisville Metro Public Health and Wellness has a flu dashboard. Now, not every case of flu in the county is reported on the dashboard, but you can certainly see important trends. More than 3,000 new cases were added to this. And if we talk about why do we have so much flu? Why are school children being so affected by flu this year? I think the answer is in immunization rates. Less than 30% of children in Jefferson County received a flu vaccine this year.
Thank you, Dr. Bryant. We will turn to questions now. Paul, you can go ahead.
Yeah, doctor, good morning. Why the low vaccination numbers? What do you attribute that to?
I think there are probably multiple causes. So every year we have parents who say, I meant to get my child vaccinated, but I got busy and I just forgot and life intervened. So that's part of the story every year. I think some parents may just not realize that flu is not just a cold. Flu can cause serious illness. It can result in hospitalization, life-threatening illness. Across the U.S., more than 200 children died of flu last year. More than 200 kids died last year across the U.S. According to data reported by the CDC at the end of January, across the U.S., there had been more than 40 pediatric flu deaths. We have not had any in Jefferson County this year. So some parents just may not realize the potential severity of flu.
And we have reached the point where school districts are either closing or going to NTI. What's your best guess as to what's going to happen in the near future? Are we going to see this trend continue of 3,000 cases per week here locally?
So traditionally, when we have flu outbreaks, well, let me back up. Let me say that we know that children play an important role in spreading flu within a community. And historically, when there's a holiday, for example, the December holidays and kids are out of school, sometimes that can interrupt transmission. Historically, in other cities that are experiencing flu outbreaks, when there's a big snowstorm and everybody stays home, you see a decline in cases. And so I suspect as a number of schools in the area move to NTI or some schools have closed, that likely will lead to a decrease in flu cases if we can learn from history.
And I saw someone with WLKY had their hand raised.
Hi, yes, this is Madison with WFKY. Good morning. Thanks for hopping on with us. So as far as we've heard people trying to get a hold of maybe Tamiflu are having trouble doing that. Have you heard of any shortages of that just because of the numbers, people having trouble getting hold of that medicine?
I personally have not heard of Tamiflu shortages. We might talk about Tamiflu for a second. So many viral illnesses have to run their course. There are actually a couple of antiviral medications that can be used to treat flu. They are most important if started early within the first 48 hours. They're used after 48 hours in some people who have severe illness or who are at high risk for infection. And so some parents may say, well, hey, my kid has symptoms of flu. Do they need to be tested? Generally, testing can sometimes help sort out whether a child needs an antiviral treatment, especially if they have underlying conditions that put them at high risk for complications.
And then just to follow up, for people, maybe their kids have already had the flu, it's still important for them to get the flu shot. Why is that? Or should they still get the flu shot after having it?
Great question. So there are multiple types of flu. Right now we're seeing influenza A circulating. We're seeing two types of influenza A circulating. We're not really seeing influenza B. The CDC has recommended for many years that we continue offering flu vaccination throughout the season, well into the spring, as long as flu vaccine is circulating. And so a child who has influenza A now could be infected with influenza B later in the season. So influenza vaccine can still offer benefit. For kids who are home and who are well, they're home because their classmates or their teachers are sick, there is definitely a lot of benefit to getting flu vaccine.
Doctor, following up on that, how long does it take for the vaccine to take effect?
After vaccination, it takes 10 to 14 days to develop an antibody response. So if you get flu vaccine today, you won't have immediate protection. And flu vaccination doesn't protect you today if you were exposed yesterday, but it offers a lot of benefit for the coming weeks. And flu season could go on for a number of weeks, so still beneficial.
Doctor, put this in perspective, how bad it is this season based on the fact that you have a very large school district like JCPS sending kids home because of the large number of illnesses.
This is definitely an unusual year. So at Norton Children's, we are seeing extraordinary numbers of children test positive. Just by the numbers of kids testing positive, this is one of the worst flu seasons in recent memory. If we think about severity, well, that story is still being written. In terms of school-based outbreaks and schools closing, this is definitely an unusual increase in the number of school-based outbreaks. And I cannot recall a time when we have had this many school closings and schools moving to NTI because of flu. This is an exceptional year. And I think it gets back to immunization rates, which have been falling since 2020.
Dr. Bryant, that was actually my question for you, is comparing vaccination rates maybe last year to this year, where does this year fall? with how many people or kids are getting vaccinated, maybe compared to last year, if you happen to know that.
But nationally, the numbers are down. And the numbers of kids getting immunized has been falling every year since 2020. At the end of January, the CDC reported that less than half of kids were protected against flu. It was around 44%. In Jefferson County, it's less than 30%.
And Jose, I saw you had your hand up a little while
Yeah,
ago.
can you hear me?
Yes.
Yeah, my question was very similar to the one they did previously. If a family has someone sick with flu, is it too late to go get vaccinated, the whole family, or not?
So it's a great question. So flu vaccine doesn't work as post-exposure prophylaxis. So let's say somebody in your family has flu, you've not been vaccinated, you've been exposed to a person who's sick. Getting flu vaccine is not going to protect you if you've already been exposed yesterday, but it will protect you in the weeks to come. So it's still a good idea to get vaccinated, but it does take 10 to 14 days to make an effective antibody response. And that is why we always recommend that people get vaccinated, preferably before Halloween. Preferably before flu starts circulating in the community. That's when it's most effective, but that doesn't mean that it's not going to be helpful now, because flu could circulate for a number of weeks.
Dr. Bryan, is vaccine fatigue still a thing?
I think so, Paul. I think that we have seen a lot more questions about routine vaccines, vaccines that we know are very important for keeping kids healthy. And so that's why it's so important to spread the word that flu vaccines are recommended for everyone 6 months and older, and they help keep kids healthy. They reduce doctor visits for flu, emergency department visits for flu, and they reduce the likelihood that a child will end up in the hospital or with a life-threatening case of the flu. And so while there may be fatigue, we just need to keep sharing the important message that flu vaccines can help keep kids healthy and in school learning.
Dr. Bryan, you kind of touched on this a little bit, but since those vaccination rates have been falling since 2020, do you think that's primarily tied to vaccination fatigue, more people questioning, any sort of reason why we might see less people getting vaccinated since 2020?
I think there are a lot of factors contributing, and vaccine fatigue is certainly one. I think during the early years of the pandemic, we didn't see a lot of flu circulating when we were staying home and wearing masks and taking precautions. A lot of viruses that are common did not circulate. And so some families may have just flu fell off their worry list. And, they tend to think of it as no big deal, or they think of it as not something that is going to affect their child. I think we also have to remember that access is likely part of it. Not all children may have ready access to flu vaccine for a variety of reasons, and we need to continue to reduce those barriers to make sure that flu vaccines are available to every family that wants one.
And Dr. Bryant, we have another question in the chat. What would you say to parents who are apprehensive about vaccinating their kids?
Flu vaccines have been around for a long time, for many years, and they have an excellent track record of safety. So the American Academy of Pediatrics recommends flu vaccine for every child 6 months and older every year, as one way to keep kids healthy. The most common side effect of a flu vaccine is some soreness at the injection site. Fever is pretty uncommon. You may have some muscle aches, you may feel tired, but compared to actual flu, the side effects of flu vaccine are really mild, and many people have no side effects from flu vaccine at all. For kids and adults who don't want a shot, there is a flu nasal spray vaccine that is appropriate for some healthy people who are 2 years and older.
And Fernando, did you have a question you wanted to ask?
Yes, good morning. I wanted to see if Dr. Bryant, you could talk a little bit about what are some of those barriers that you were mentioning that could make it difficult for some children to get their flu vaccines or for some families to be able to get their kids vaccinated.
Yeah, so let's talk about barriers to vaccination. These are general barriers, and then some specific barriers to flu vaccination. I think one is access. Not every child has a pediatrician or a pediatric care provider. Some kids do have a pediatric care provider, but their parents have a lot of difficulty in getting them to the doctor's office because of work schedules and school schedules. Some parents may not have the information that they need. It's not been presented to them in a way that resonates about the importance of flu vaccine. I think those are the big ones.
Dr. Bautista, is there an outreach program that the health department is doing to get the word out to these parents and these kids who may not have access or may not know about their access to vaccines?
I can only speak for La Casita Center and family health centers, and of course, Louisville Metro Public Health and Wellness. We try to make available all the information regarding upper respiratory viral infections and the importance of vaccination. And what we do at La Casita Center is to be the bridge or the liaison with the services and the resources available in the community, like Family Health Center, or in some cases, Family Community Clinic. Many of our community members have Norton as a primary care provider. So what we try to do is to bring the information up on front in Spanish in videos or flyers, and we try to remind them of the importance of vaccination. And when we have community events, we also host partners that bring vaccines that are available for mainly for adults, but we have worked also with Norton as in partnership. Last October, we did that at one of the communities offering the flu vaccine for kids and for adults.
Paul, if I could just add on, we've been doing a lot of messaging this year. Some of you all may have seen it about flu vaccine and COVID-19 vaccine. We now, with the outbreaks, we've been doing a lot of messaging with parents who have their kids in schools and childcare centers affected by the outbreaks. Norton promotes flu vaccine to all of its families as they promote all vaccines that are recommended by the CDC and the AAP. I think that what this year tells us is that we all have more work to do, And those of you on this call are an important part of that, helping us get the word out.
And Zan, did you want to ask your question?
Oh, yes. I was really just kind of wondering, would you recommend people get their other respiratory illness vaccines, like the COVID vaccine, like the RSV vaccine, as well as getting the flu shot this year? And like, are we seeing a rise in those other respiratory illnesses as well as the flu?
I recommend that people get all of the vaccines that are recommended by the CDC and the American Academy of Pediatrics, because these recommendations are made to keep people healthy. So let's talk about COVID-19 vaccine. An updated COVID-19 vaccine is recommended for all people 6 months and older. Very young children who've never been immunized still need a series of shots. Older children and adolescents and adults just need a booster. COVID hasn't gone away. We are still seeing COVID-19 circulating in the community. In terms of RSV, RSV season started earlier than flu season. It seems to be winding down, but it's still important for babies who are being born right now to receive the immunization that boosts the immune system against RSV. RSV vaccine is recommended for adults 75 and older to protect them, and people 60 to 74 with certain underlying health conditions. And so, yes, I absolutely recommend those vaccines as well. Now, we know that there's been a lot of public pushback, about COVID vaccine. I think that what we can tell people is that it's not an all or none, right? Let's talk about your concerns. As your physician, I want to talk to you about the vaccines and the recommendations, and give you the information that you need. If people turn down one vaccine, doesn't mean that they'll turn down every vaccine. But we should offer.
All right, are there any other questions? Okay, Dr. Bautista Severa, can you provide a summary of what we discussed in Spanish? And then
Yes.
if there's anything else you want to add too.
Thank you, Dr. Bryan. Esta es una reunión para informar a la comunidad que la temporada de influenza o flu, como la conocemos, está a todo lo que da. Y a quienes más está afectando es a los niños. Se han reportado brotes epidémicos múltiples, pero sobre todo en lugares en donde hay concentraciones de personas más importantes, como las casas para ancianos, las guarderías para los niños y para las escuelas. Esto puede explicar el por qué nuestro distrito escolar está en NTI en este momento por el gran número de niños afectados por influenza. Tan solo esta semana se han reportado en Norton 3,000 nuevas pruebas positivas a influenza, aunque recordemos que no todas las personas que tienen influenza se hacen pruebas y no todas están documentadas. A lo que se cree que se debe este problema con una gran cantidad de niños afectados por influenza es que menos del 30% de los niños en nuestro condado y en nuestro Commonwealth, en nuestro estado, han recibido la vacuna. Y para tener una protección con la vacuna necesitamos más del 44%. En Kentucky estamos con menos del 30%, por lo tanto es muy importante que en casa, si aún no se han vacunado sus niños, los lleven a vacunar. Se cree que este brote que estamos sufriendo como comunidad va a mejorar conforme se estén separando los niños, y aunque se se puede usar antiviral. El antiviral solo está recomendado para aquellas personas que tienen un riesgo alto al sufrir la enfermedad. Sin embargo, si usted observa que su niño tiene molestias o ve algo anormal, es importante que lo lleve a que lo revisen y le hagan una prueba, porque la prueba va a guiar el tratamiento que el médico va a ofrecer. Alguien preguntaba si a pesar de tener influenza es todavía recomendable ponerse la vacuna, y la respuesta es sí, porque la influenza en este momento está causada por el virus de la influenza tipo A, pero también hay un tipo B. Por lo tanto, aunque estemos en febrero, es muy importante que si usted no se ha vacunado o no ha vacunado a su familia, o aunque ya haya tenido algún tipo de influenza, se vacune, por favor, para prevenir todos los tipos con los que nos ayuda la vacuna a prevenir. Me parece que esto es lo más importante. Recuerde, si su familia ya está enferma, vacúnese. No la va a proteger de forma inmediata, porque la acción de la vacuna empieza entre los 10 y los 14 días después de haber recibido la vacuna. Sin embargo, la va a ayudar en lo que resta del periodo en el que se puede infectar por influenza. Y las causas por las que la gente no se ha vacunado es falta de acceso, es que hay fatiga por vacunación. Recordemos, lo más importante para prevenir esta situación que no se ha documentado antes, es la primera vez que la doctora Bryan ve que varios distritos escolares se hayan cerrado, es algo que no se había presentado antes. Es importante que, si usted está enfermo, se quede en casa, se laven las manos frecuentemente, se tape la boca al estornudar o al toser. Si no se ha vacunado, vacúnese. Y si tiene que salir enfermo, póngase cubrebocas. Si usted no está enfermo, pero tiene riesgos altos de enfermarse, por favor, use su cubrebocas para evitar enfermarse. La invitación por parte de la doctora Bryan, por parte del Louisville Metro Public Health and Wellness y por parte de los que estamos involucrados, es que por favor se vacunen. Es un equipo, es un trabajo de equipo, y todos podemos contribuir en él. Right.
Thank you so much. Is there anything else that you want to add, Dr. Bryant? Or
Kristen, I might just add, the question came up earlier, what are we doing about access? And so I will share some exciting news that Louisville Metro Public Health and Wellness is piloting a mobile vaccination model. We have brick and mortar immunization clinics, but we are working on a model of taking vaccines, including flu vaccines, into the community so we can immunize people where they live, where they work, where they gather. And I think this is an important measure for improving access. And when we're out in the community, we can answer questions and educate.
okay, thank you so much for that. All right, any other questions?
I think there was a question in the chat from Jose about could we name what school districts have closed due to current influenza? So there are multiple school districts across Kentucky that have had to take steps because so many children and teachers are sick with the flu. So Jefferson County, my understanding, is moved to non-traditional instruction, or NTI. There are other school districts who've opted to close for a couple of days, others who've also adopted NTI. I personally don't have a complete list right here on this call today, though, but it's multiple school districts in our metro area and across Kentucky.
I think one of the affected districts is Alton County, Bullitt, LaRue, and some other that don't come to mind, but either they took a couple of days or they went to NTI if they had the resources for that.
And Fernando, the program to bring vaccines into the community, or the mobile vaccination program, That is rolling out now. That was planned. That's been a long-term plan to do that and move beyond our brick and mortar immunization sites. So planned well before the current flu outbreaks, but starting now. I believe we did have some in January, but they will increase in frequency over the coming months. You'll hear a lot about these. And it's not just flu vaccine. It's a variety of vaccines that we can bring into the community.
Thank you for pointing that out, Dr. Bryant. All right.
Kristen, if I may add in
Yep,
Spanish,
course.
Dr. Bryan recomendó que no solo nos vacunemos contra influenza, sino que recordemos que el COVID también sigue activo, sigue habiendo personas hospitalizadas y lo más importante es que COVID sigue causando muerte. Entonces, no solo se vacunen contra influenza si tienen acceso, consiguen vacuna contra COVID-19, por favor póngansela. Para aquellos mayores de 75, la vacuna contra RSV es muy importante, o si tiene más de 64 y tiene alguna enfermedad crónica que lo haga sujeto de riesgo. Gracias.
Thank you, everyone. Thank you, Dr. Bryant, and thank you, Dr. Bautista Severa, for joining us and sharing this important information. And thank you to everyone who was here on the call today and who is sharing this important information with our community. All right. Have a great day.
Thanks,
Thank you.
everyone. Stay well.